Hello, everyone. I am here at the Matricas event with Sally Hayes, who is CEO and founder of Matricas, and the person behind bringing us all together. Sally, we love you so much. Can you please give us a little bit? Tell us about Matricas. Tell us what you do, where it came from, why we're here today, and so happy to be here today.
Absolutely. So Matricas was born because I was a prenatal massage therapist for 26 years, and my clients continued to ask me for referrals. And they asked me for referrals for everything. Everything.
It's like a hairdresser, right? You just kind of like go there and like as you're massaging. So do you have someone that does scans?
Yeah.
Do you have someone that does ultrasound?
And that's where I started reaching out to people to try and find out. And the more people I reached out to, the more people that started to reach out to me. And I started to kind of connect that spider web, right?
You were like a hub of everything coming together.
Exactly.
So what sort of like now within the maternal health space, what different, networking have you got to different healthcare spaces? Who do you have in your network at the moment?
We have everyone from fertility. We're here at a fertility clinic.
Fertility, thank you.
We have doulas, we have scans, we have a sex coach, we have genetic counselors, we have the full spectrum. So I believe that you've heard the phrase, it takes a village,
It
right?
takes a village. I say it all the
village.
time, actually. I say, because in My Butt, My Baby, we're our own little village, but you can become part of bigger villages and become like wide cities if you...
Exactly. So everyone talks about this village, but nobody tells you how to build it or where it is. So we are trying to build a village online for an online directory that you can just go on. I saw plenty of clients that were looking online at 3 a.m. when they were breastfeeding to try and find out like where. And they needed to stop doing that so that we could get back to reality and have trusted, vetted partners. And then also our partners all work together very well.
Oh my gosh, Abigail. I met Abigail through you, and I was saying that our office in LA in Torrance will be with midwife Abigail Prashkansky, and she is amazing because she'll be in the office with us. That happened because of Sally. Sally's ability to network and put me in Abigail's game. So I've got a midwife that needs to have ultrasound, and I have an ultrasound person that hasn't got a midwife. Duh, let's put it together. And so that is how me and Abigail were born, and you'll hear more about our journeys in LA. However, yes, back to Sally. So we have midwives, we have ultrasound, and you're active. I mean, you're based or you're born in LA, right? Right now we're in New York. That's how far around Sally's getting. She's going from LA to New York. What are your plans in terms of like your networking? Are you in every state? Where are you going to?
So we are throughout the US, and we also just got our first Canadian member, which is super exciting.
Canada, we're with you too.
We can't forget about Canada, but we have in-person networking in LA, New York, and Detroit.
Wow.
Next year, that will expand.
Wow. And where are we planning to get to next year? Like
Atlanta's the next hub.
We're going to Atlanta too?
Yep. Greenville, South Carolina.
Wow. Okay. Yeah.
Possibly Orlando, Florida, Portland, definitely Virginia, DC.
This is going to become a national thing. I don't see how, like as you just grow and, like I kind of imagine one of those images where you have a spider web and it starts going ding, 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 ding. And you see everything connecting.
Exponentially grows.
You're connecting the dots. And as these dots are connecting and then they're bringing their connections, it's just becoming an absolute masterpiece. And eventually you have to go, of course, to London. Always got to give a shout out to London. And you've got to go across the pond and help them over there as well. And start building
in London the other day. She's an American, but she has a postpartum new group that she's starting. So I'll get you connected.
Thank you very much.
So one thing that we do is we ask everybody, what is your big, bold ask?
Okay.
Right? What's your brazen ask? And that starts sparking the interest in people because a lot of what we do when we're in private practice is we're filling the gaps, we're putting out fires, right? And we know stats aren't great in the US, right?
Of course.
We know. We don't need to lean into that. You know what we do need to lean into? Creating that new future. Creating that
solution
thing.
It's solutions, not problem based. I think that is what I see a lot of, where you're scrolling online and it's just misery. And I get it. You're 100% right. And everyone should have the right to share their problems as much as their wins, right? But I don't see enough solutions. And then when I do see them, everybody's working in their own individual corners and reinvented wheels all over the place.
And we could just be doing this together.
Like why it doesn't matter. Like even when we think about we are. When we think about our foundation, that was the point of we provide the ultrasounds for low income minorities, but we then put those out to the other sonographers, to the other maternal fetal medicine physicians, so that we're building this village. Some of these women don't have access to care. We don't provide care, but we can tell you where to go to get that care.
Exactly.
And that is how it works. It's like, it's just being a stepping stone. We can help you get to where you need to be.
Exactly.
And with Sally, you'll always get to where you need to be.
Exactly. So I think there's basically 3 pillars. And the first one is community precedes policy. So we have to create a robust, strong community.
Yes.
So that in Georgia right now, they're fighting to get licensed midwives, right?
Wow.
Well, we can all lend our voices to that. That's what they all say. Show up in numbers. We need you to show up in numbers. We need you to sign the petition. We need everybody to chip in $5, right? If a birth center is closing, we all need to jump in and fix that. And there's strength in numbers. So number one, community, build this strong community within the practitioner sphere. Next is educate the public. The public doesn't often know what they need and that there's stuff out there. Not only are there stuff out there that you need, but there are nonprofits that pay for it.
Exactly. Thank you for the nice segue and plug there for my But My Baby, My World Foundation. And we offer free sonograms for low-income minority families and military families. Thank you.
Yeah.
But yes, and that point, exactly.
And people
don't know about it. And the problem you have is that when people go on the internet nowadays or social media, you have influencers that have actual more influence than your doctor, than even your family member sometimes. And unfortunately, it's educating everybody. Because if we can educate the influencers, then they can influence the right message. But unfortunately, if they don't have the right message to share, then what do? They're just sharing what they know. And you can't be mad at anybody for sharing what they know. But that being said, the messaging is a problem. And part of what we're trying to do, especially with our recent ad campaigns, is letting people know that in our field, in our lane, ultrasound is a tool that is used by providers to assess your whole care, like your whole. It is not going to replace a prenatal appointment.
Exactly.
And that is a perfect example of where a woman goes, but I saw my baby's face today. I saw my baby's face and I saw a heart beating, and that means my baby's okay. No, it doesn't. It means you saw your baby's face and you saw a heart beating. And that's all that means. And until a doctor's told you the complete wellness of yourself or of your baby, you don't know how you guys are doing right now. We had, unfortunately, a person that left a Google review for an ultrasound company. And they said, thank you for the pictures of my baby's face, but you could have told me he didn't have any legs. And that is what we're dealing with, because that scan was probably $25. And they went, hey, come for a scan for $25. We'll show you a picture of your baby's face. He didn't lie. He showed you a picture of your baby's face. But did you have peace of mind? Temporarily, until you went to the doctors. So if you want real peace of mind, you need to see a physician. You need to see someone who's connected to a physician and make sure that they are assessing your care properly.
Exactly.
And that's all messaging. So thank you for that.
Yes, it's true. And I know that you have very high standards when it comes to
extremely high standards.
They have to work 5 years.
At least 5 years. They have to work within MFM. They have to have some MFM experience. And as a midwife, I know about crossing my T's and dotting my I's. And if it's not documented, it didn't happen. So the benefit of putting somebody that's clinical in this position is that I'm not letting any of my clinicians down. I'm not going to let any of them fall. I'm not going to let anyone, do anything to them. So they are going to be covered. And for them to be covered, you need to make sure they have the right licensing. They have the right insurance. They are eligible to perform in that state, and there is a physician overseeing those sonograms. And if there is not a physician overseeing your sonograms, then you should not be performing any sonogram.
And then the third thing that we do is we change policy. So first we start with building the community. Second, we educate the public. And then third, we start actually making change with changing policy throughout this country. Okay, so tell me how My Bump My Baby got started.
I was in the States. I've been in the States now for 10 years. And when I moved over here, I always had an intention of starting some sort of organization within maternity. Coming from the UK and the NHS, there are so many amazing parts of the NHS. However, I was able to see the difference between NHS care and privatized care, and what the similarities are, what the differences are, but also where I could make it better. Some people in America feel that the NHS is great because it's free, and free healthcare means everything's great. equally, there's people in the UK that feel like America has privatized healthcare and it's private and everyone pays for it, so it's great. And I'm here in the middle to go, I've had a baby in both situations. I'm here to tell you that both of them can use some improvements and that the grass is not greener. By not only living the experience of a mother having babies, being a midwife in the UK, but having babies in the States as well, and then working in corporate America, working for Fortune 200 organizations, working for up and coming, startup healthcare organizations, it really gave me an insight. Sometimes I felt like a little mole, like on one of those shows, The Mole. They're seeing this now and they're like, oh, I know Charlotte was going. But I do, because I never had any intention to stay forever. And they knew that when I had, and I always talk about like my goals and my dreams. And I'd be scared that if I told them everything I wanted to do, they wouldn't hire me. But sometimes like, oh yeah, go on, dream. Keep on dreaming as you build our company up to where we want it to be.
Yeah.
And honestly, I will always say this, Kindbody inspired me more than any company that I'd worked for. When I worked for Kindbody, they had a fully female board, and it was women from all different backgrounds. There was a woman of every color on that board, every background came from, and I genuinely was inspired because I worked for that company and I said, if they could do it, I could do it. I spoke to my mother, I can do this. I've been a midwife for over 20 years. I've got more experience than some of the doctors that I meet. And therefore, I think I could do this. And the thing that stops you is yourself. It's not anybody else. I didn't care what the opinions are. I didn't want to do it because I was scared. And when I shook that off, and after I went to Kindbody, I was like, I've got to do this. And I started in 2022, December, my baby was born. And at that point, we were just doing in-home sonograms. I was working with GE, big shout out to GE. They have the most amazing V-scan airs. And these V-scan airs were used in the military. They're used all over already, but they were just not used that much in obstetrics and in maternity. So I, being Charlotte, jumped on the phone and tried to speak to the right people. And we were using these V-scan airs. They allowed us to give peace of mind. And I say they gave us peace of mind. We gave a very quick overview. It allowed me to do a lot of research into in-home sonograms, what worked, what didn't work. And then we had to regroup because it wasn't working. And it wasn't working because I, as a practitioner, did not feel I'm not a practitioner in the US. In England, I'm a midwife. I can do midwife stuff. In the US, I am just Charlotte. I am not a midwife. I'm just a knowledgeable human being. And so because of that, when I'm scanning women, although I can give advice because I know advice, I'm not allowed to give advice. I need a midwife. I need a MFM that's licensed in the States. So I did a complete regroup. And I was like, we need a physician to oversee us. Sidebar, whilst I was doing that, I didn't feel like the women that needed, and I say needed, all the women needed the service, but clinically needed or socially needed were able to afford the service. So people that were able to have my service were those of a certain economic lifestyle that could just afford to pay for an extra scan and come in their house. And that just wasn't something that everybody could afford. At that point, we weren't a charity, and I couldn't just give it out for free. I've got to pay sonographers. I've got to pay insurance. I've got to pay all these licenses. We can't just give it out for free. And I created the nonprofit foundation, My Baby, My World, and we started that in June of 2023. And our foundation serves low-income minority families and military families because I wanted to make sure I could grasp as much of the population as possible. And we offer one free sonogram in each trimester. So they have one in trimester 1 and 2, 1 and 3. The third trimester one, we try and give them a 3D, 4D as well, because that way they don't need to go and pay for one from a dodgy place that shouldn't be doing sonograms. So if you're having it free from us, then why pay? We do it for free. So we started the foundation. And again, a lot of our interviews with our patients, they say skeptical. Why we're skeptical? Why are you going to give us stuff for free? Like, especially in America, I come from NHS, right? There, everybody expects it to be for free.
Right.
You come here and you're expecting to pay. So when someone says, hey, what do you want for my baby? All of them looked at me and said, why are you scanning me? And then on top of it, we're in New York, and my fiance tells me all the time, like, New Yorkers, they're you can't get one over on them. Do you know what I mean? They're very clued up. So you say, hey, this is for free. Like, why is it for free? Why are you giving it for free? And I'm British as well, so they already think I'm putting on accent. Why are you talking like that? Why are you giving me stuff for free? I love watching them have these free experiences, see their babies. On Sunday last week, a woman cried. She said she's not seen the baby's face because at every doctor's appointment, it's so quick that when it gets time to see the face, like, oh, sorry, the baby's not in a good position, we gotta go. And so we literally, you're not leaving here today until we try and see this baby's face. And we explained that sometimes baby is like this, there's nothing you can do. But she just felt like they didn't even try because, and I know exactly what she meant. That sonographer was only rushing because she had another person outside. And unfortunately, your baby's face isn't on the diagnostic sheet, so you have to see. So can't see it, gotta go. Don't blame the sonographer. It's not her fault. She was doing her job. But when you have a conveyor belt of patients, that's what the doctors are for. Go there to see your medical space. I believe there is a space for ultrasound for mental health. I believe there's a space to say that a woman, I've cared for women, drug dependent, drug abusing women before they were pregnant, and they'd say that those sonograms helped keep them away from that substance. To see their babies, it created something inside of them. And I don't think that's something a medical person can turn around and say, that's not okay. Because if I was high risk, you could scan me every other day if you needed to, every other week if you needed to. So who's to say that that won't help my mental health? And why can't insurance cover a scan for peace of mind during pregnancy? Right. That's where your policies come in. Yep. And so, yes, we are the first pregnancy imaging center of our kind, offering in-home and in-office sonograms. We're doing that in New York. We're going to be doing that in LA as of next month, and we'll be in London as of January. So very exciting things for the in-office. However, in home, we have our in-home service agreements with our amazing partners in Florida, in Chicago, in Atlanta, in Texas, Dallas, and Houston. I have to be careful because Texas is so big, and I'm learning. You say Texas, you have people from everywhere calling you. Dallas and Houston. I'm sorry, Texas. I'm coming. Just let me get my bus first. Donations bus. I'll get to you. California, of course. New Jersey, New York. We're right by there. That works. Connecticut. And PA. Yeah. So cool. Okay. If they go on our website, they can see we're getting around, and I'm trying to be everywhere, but one step at a time. Systems in place. Systems in place.